Hello and welcome to Massage Science. My name is Brandon Cope and today we're going to talk about herniated discs. Now, a person can get a herniated disc in their cervical spine or also in their lumbar spine. Today I'm going to focus more on a lumbar herniated disc. Now, you have little discs, which are cartilage that sit between your vertebra in your spine, and they help you with shock absorption. Sometimes those discs can get damaged, and the damage can be very progressive and degenerative, getting worse. And what happens with the herniation in particular is that the disc will move outside its normal space. It has a nice little position that it normally sits in between the vertebra, but if it starts to move outside of that space, that's where we would call it a herniated disc. Now, there's 4 different stages of this movement that we usually title as a bulge, a protrusion, an extrusion, or a rupture. Now, the bulge you might have heard before. That's pretty common terminology, and that's where the disc itself is just beginning to move out of place. It's kind of going in a direction outside of the vertebra. The protrusion is when the inside of the disc, which we call the nucleus of the disc, starts to actually move out of that space and kind of push up against the wall of the disc. An extrusion is where now that nucleus on the inside has moved itself outside. It's kind of broken through the disc surface and it's pushed itself out of the disc itself. And then the last one is the rupture. That's where the nucleus has basically ruptured. It has crumbled apart and its substance is now freely flowing outside of the disc. Typically at that stage of a rupture, the disc is severely damaged and a person needs some immediate care to get that treated. Now, what would cause somebody to get a herniated disc? Typically, it's going to be compressive forces in the spine. A lot of wear and tear and pushing down from the vertebra that get into the disc, pushing down on it, compressing it, forcing it to push out of its position. The typical movement people will do is lifting and twisting at the same time. They carry a heavy object, they lift with their back and they twist, and that usually triggers the compressive forces to push the disc out of place and cause the initial symptoms. People can usually lead into this by having poor posture, typically that flat back where people kind of round forward. That's the typical posture that will lead up with compressive forces to that triggering event and cause the herniated disc. Usually the symptoms that people start to feel are pain in their lower back. The pain will travel down into the legs, and sometimes the nerves and the nerve roots can get irritated, and that's where we get a lot of sciatic symptoms where people have that pain in the back of their legs. People usually get some numbness and lack of strength and range of motion as well. The standard treatment that most people will get for this is bed rest. Just relaxing their back and trying to wait it out and see if it gets better, maybe with some painkillers and some hot and ice as well. They might do some traction, they might go see physical therapists, try to do some core strengthening exercise, and then the surgical option is usually a discectomy, and that's where they might go in surgically and try to remove a part of the disc or the entire disc and try to repair the space that has been pushed out there. Now, for us as massage therapists, if we're working on somebody who has a herniated disc in their lumbar spine or even in the cervical spine, we have to be careful to not over-release. We want to make sure that we don't destabilize their spine by releasing too many muscles. Typically, in a condition like this, the muscles will start to splint and spasm, and they'll get very tight, and it's tempting for us to want to go in and release those, but we have to be careful we don't release too much and throw the spine out of stability. If we are going to work on somebody and we have some moderation with our techniques, typically we want to focus on those hip flexors. So that's going to be that psoas, iliacus, tensor fasciae lata, the rectus femoris. And we might want to focus on the lumbar extensors, so that quadratus lumborum, the paraspinals, the spinal erectors, all of those muscles that go up and down in the lower back, and of course gluteus maximus, medius, and minimus. Now, if somebody has that flat back position, so they're kind of rounded forward, oftentimes the hip flexors and the lumbar extensors might actually be a little bit lengthened and weak, and we may want to focus more on the glutes or maybe the hamstrings. This might actually need to be released even more. So I hope that helps you guys. There's just a quick overview of the herniated disc, focusing on the lumbar spine, and I hope that that gets you guys some good treatments. Definitely like, subscribe, type down in the comments below and let me know if you've had experience working with people who have this condition and any thoughts you might have on it. Thanks for watching.